try to find the pain. Find the pain. Squeeze into the pain. Yes, sir. That is really, really good. Yes. Now, left side. For the purposes of this demonstration, let's assume that this rope represents your muscle. In this case now, we're talking about your lower back muscle specifically. Now, when the muscle goes into spasm, it begins to crinkle up or fold like I'm doing here with the rope. So this is what a spasm muscle would look like. Now, note that the muscle, or rather the length of the rope, hasn't changed. The length is still what it is, let's say 4 feet long. However, the effective length of the muscle or the rope has changed because it is now crinkled up, it's now folded up, so it is now a shorter muscle or a shorter rope. So how do you fix this? Now, if you try to fix it using traditional stretches and just pulling on the muscle, remember the muscle is defensive. Every time you pull on the muscle to stretch it without using any mind-body connection, the muscle will simply resist you and get tighter. The result is a tighter muscle. If you engage the muscle first and then engage the opposing muscles, what happens is, through the principle of reciprocal inhibition, opposing muscles will relax when the muscles opposite of those muscles engage powerfully. So the key is to engage with as much might as you can, shortening the muscle. You're trying to shorten the very muscle that you want to relax. So every time you flex it hard, it's going to be painful. It will hurt, but the end result is by shortening the muscle as much as possible and then lengthening by flexing the opposing muscles, the result is the muscle begins to relax. And that's what you want. Now, make note, engaging a muscle that is already in spasm is quite painful. And this is why it's never recommended. But what I recommend, if you have lower back pain is you absolutely must engage the muscles which are in spasm. And in this case, we're talking about the lower back muscles, and most specifically, we're talking about the quadratus lumborum, which is usually the culprit, the thing which is in spasm when you have lower back pain, which results from either sitting too long, sitting too much, or from running too much or other athletic endeavors. The QL tends to get very, very much in spasm. So this is the key, engaging the muscle with as much power as you can, and then engaging the opposing muscles. Now, how do we do this? We do this using pelvic tilts. So you tilt the pelvis anteriorly, and then you tilt the pelvis posteriorly. So the muscles which tilt the pelvis posteriorly must engage, which relaxes the anterior muscles. And then you tilt the pelvis posteriorly, engaging those muscles, which helps to relax the anterior muscle. So that's pretty cool. And that makes a huge difference when you do the pelvic tilts. The other thing that you should do for tense, painful muscles is to apply some kind of myofascial pressure, pinpoint pressure preferably. I like to use my knuckles or my fists or elbows, but I press into the muscle fiber where it is tense and painful and hold that pressure. The muscle oftentimes will go into this little twitching, which means it's about to release. So the muscle releases, and then you repeat that pressure. When you press into the muscle, you want to bring the pain level up to about an 8. Hold it until you can mentally relax it down to a 5, and then the muscle relaxes just a bit more. You can also apply pressure to more than one point on the muscle at the same time, simultaneously. You hold the pressure again, bring it up to an 8, hold the pressure, mentally relax it down to a 5, and the muscle again further relaxes. And you can repeat this process as many times as you want until you reach maximal relaxation for that day. But the key, of course, is using the pain scale, where 0 means there's no pain, you feel nothing, you're dead because you feel nothing, and a 10 means you wish you were dead. The pain is so high. So we want to make the pressure or make the pain level about an 8, okay? That's high enough that it gets your attention and you have to work hard to relax it down. But it's not so high that you cannot manage it. The key is manageability. You need to have a high level of pain, but not so high you can't manage it. It must be high enough to get your attention, but then you can still relax. So you bring it up to an 8, and then you hold it until you can mentally relax it down to about a 5. Now, this is important because you're building skills. Remember, pain is produced in your brain. There is a component of fear and anxiety with pain. So by applying pressure and making the pain high on purpose, but only an 8, and then relaxing it back down to a 5, you're building the skills to be able to manage that pain. And that's how you get over it, which is so cool. You get stronger because of your pain. Isn't that amazing? 2 more breaths. With each one, squeeze harder. Yes. Fantastic. Now transition. Squeeze your glutes. That's it. Squeeze your glutes. Very nice. Abdominals are flexing hard here. With each exhale, squeeze harder. Pull the pelvis up to your face. Squeeze. Yes. 2 more breaths. Last breath now. Make it a strong squeeze. Squeeze your glutes. Squeeze, squeeze, squeeze. And relax. Yes, sir. Until next time, thank you for watching, and thank you for supporting me. Kung Fu salute. Right fist, left palm. Bring them together and bow. Thank you very much.